Good afternoon. Welcome to Coffee with Cade, where our guest today is Diane Dallap, who is a rehabilitation expert. And she's going to talk about the pelvis and pelvic health and the abs and all of the ways that the pelvis can be rehabilitated to help us with infertility and sexual dysfunction. So, welcome, Diane.
Thank you, Dr. Hammond. Good to be here.
Oh, it's good to see you. Now, Diane is a veteran guest for Coffee with Cade. I think she was with us last 2 years ago.
I believe.
And it's an important topic. I know a lot of people don't feel comfortable talking about what's going on down there. Uh, and Diane's specialty is really helping individuals, women in particular, who are having a hard time in their vaginal area, and sex may be painful, and she helps kind of bring things back to a place where it can be pleasurable. So, and as we know, it's hard to get pregnant if you don't enjoy intercourse. So, Diane, tell me a little bit about what you do.
Okay. Well, I'm a physical therapist. I've been doing pelvic floor physical therapy for, about 19 years. I think it's just an underserved population, but we learn more and more about it all the time. And we have great physicians that are, learning more and more about how to help with these situations Dr. Hammond just mentioned. And physical therapy is part of that, part of the option. It's on the menu to help with whether it's pain or incontinence or pain with sex or just pain in the pelvic area, the low back even. And so what pelvic floor physical therapy does is it addresses the muscles that make up the basin of your pelvis and your torso. And of course, those work in conjunction with your core muscles. So there's a very strong relationship there. And I would probably be remiss if I didn't address them together. So it could be anything from, again, pain to leaking, urinary incontinence or fecal incontinence, urinary frequency, so just using the restroom too often.
And just so that anyone listening, if they don't know what incontinence is, can you say what that means?
So when you are unable to control your urine or your bowel movements, so basically stuff comes out when you don't want it to.
Okay.
And sometimes it's a few drops, sometimes it's a large amount. Sometimes those things work through different mechanisms, but usually improving strength and control in the muscles can help both. And sometimes there are behavioral things as well that contribute to those leaking issues. So, it's complicated, but it can definitely be helped.
So the pelvis is, you called it did you call it the crown or the floor?
The floor. So I guess I think of it like a sling or a hammock, a basin, if you will, and those muscles really kind of wrap around and help to support the contents of the lower abdominal area, if you will, and they have a role as a sphincter, so kind of a gatekeeper. Things get out too easy, maybe things are weak, things are hard to get in, they may be tight and painful. So we just try to correct, not to oversimplify it, but we just try to correct what dysfunction that we find.
So for those who are watching, please feel free to submit your questions. We will do our best to respond to your questions in writing. We'll respond on the link below your question, but Diane is actually practicing in the Baltimore metro area, and if you need support, she is seeing patients, and so definitely reach out. She's available through the Medstar National Rehabilitation Hospital website, and she can provide virtual services, virtual support for some, but obviously sometimes you actually would need to go in and make an appointment with her. So tell me a little bit about what pelvic floor therapy looks like.
Well, the first day is usually a lot of talking, and it depends. You may have a young mother that had one child, and you know, has had a little bit of tearing during the baby delivery and has pain, and maybe it's only been 2 months since the delivery of the baby. And in that case, things are a little bit simpler. There's not a longer history. But I think, unfortunately, when people have dysfunction in the pelvic floor, they often have a longer history. Sometimes things go left unmanaged. So there's a lot of discussion the first day and trying to get to the root of the problems. And I think I mentioned earlier too, you know, there's behavioral things that can, we can counsel you on to try to improve. So, you know, maybe something as simple as cutting back on coffee or acidic foods, carbonated beverages, all those things are things that irritate your bladder. So by simply modifying your diet, or by, I am certainly guilty of this, you know, you go to the restroom right before you leave the house, but maybe I just went like half an hour ago.
Yeah.
You know, bladder most likely isn't full. So, you know, things like that, you kind of create habits that may, you know, cause your bladder to not function as well.
Okay. Okay. All
So,
right.
yeah, so discussion and I guess counseling, you know, trying to tweak whether it's diet, behavior. I also would do an exam. We are looking for muscle weakness, muscle tightness, try to improve balance around the pelvis. So there is a very, very strong link between your core muscles and the pelvic floor muscles. So I guess the other component of physical therapy treatment would include making sure that the muscles function properly. So if you have ever tried Kegels, you will also get firing in the lower abdominal muscles. So again, there's that strong link between the core and the pelvic floor.
So wait. Now you mentioned the word Kegels. Can you
Sorry.
describe what Kegels are for anybody? And I'm going to challenge everybody who watches this. After she describes what a Kegel is, I want you to do Kegels through the rest of this presentation. Try it. So
So,
you know, it may help you.
oh,
So, but tell us what it is.
so a Kegel is a contraction of the pelvic floor. So if you imagine drawing vaginal opening kind of up and inward, if people are very weak, I usually would start them on their back because there's less gravity involved. But sitting, absolutely, you can do that. And that's something that may help you to hold your bladder longer. It may help prevent leaking. And it, you know, it may actually help with your enjoyment of sex, because if the muscles are loose, the sensation is a little bit different. So
1, 2, 3, clench.
Amen. Yes. And I guess I should say too, you know, we will often do contractions where you hold for a period of time. So, you know, prolonged contraction, and then you do some where you're just moving quickly, just, you know, contracting and letting go, contracting and letting go. And the thought process there is much like the rest of your body. You have muscles that work in more of an endurance fashion, and you have muscles that work in more of a power fashion. So like marathoners and sprinters. So it might be good to do some where you hold for 5 or 10 seconds if you can, and then some where you're just lifting quickly. And those are, I think, are much harder.
Okay, so everybody who's watching this, I challenge you to clench, hold for 4 seconds, and then release. And do that for the next 10 minutes. Okay, ready, get set, go. 1, 2, 3, clench. 1, 2, 3, go. 1, 2, 3, clench. Keep on. All right. While we're all doing Kegels, Diane, please continue.
So one of the other things that I think, and especially as it pertains to infertility, and Dr. Hammond, correct me if I'm wrong, but when you have fertility treatments, the likelihood of multiples goes up. So in other words, having twins and triplets, is that an accurate statement?
Well, it used to be when they were putting back more than one embryo, one healthy embryo. Nowadays, most clinics are only putting back one healthy embryo into a woman going through fertility treatment, because the likelihood of pregnancy doesn't change if you put back more than one, but the likelihood of multiples does increase. And multiple pregnancy, or pregnancy with more than one baby, poses risks for both the child and for the mother. Like if the mother ends up going into labor early because there's all that baby and that weight in her womb, and her cervix can't handle all that weight. And any preterm birth can be a problem, because if the baby's not fully developed, then the baby can have lifelong problems. The mother can have complications. And so they really do, most clinics are really putting one embryo back into women. But, there are more multiple pregnancies.
Right. Okay, so that's great to hear. And maybe is good to hear in terms of what I was about to mention too, which is a condition called diastasis recti, which is where we can just refer to as DR if that's helpful, which is a condition where as the baby grows, it pushes against the front of your abdominal wall and it splits the abdominal muscles. If you were to be pregnant with twins or triplets, that would increase the likelihood of having that split. And it happens with every mother as the baby grows. So it's not an abnormal thing. I guess it's just a matter of how much that they stretch. Other risk factors would be multiple pregnancies. So if you're on your second or third child, having a weak abdominal wall, and maybe having a baby later in life. But I think the key thing there from a physical therapy perspective is the weak abdominal wall. So even early in a pregnancy, if you're able to do some Kegels and do some gentle abdominal contractions, you're not going to be able to prevent those abdomen muscles from slitting because the baby is growing and pushing against it, and that's of course a good thing. But perhaps you can make it so that the muscles are in a little bit better shape and maybe you recover a little bit more easily. So again, if any of you have experienced, feels like a gap, and if you were to lie on the floor and lift your head, you may find that there's like a little pooch there and you can stick your fingers in sideways. It's kind of funny these days that this is how we diagnose these things. If you're able to fit 2 fingers in, that's kind of right on the border of normal. Any more than that, even if you don't have pain, it might be worth mentioning to your doctor. And so even without pain, it might be something that destabilizes your core. It may lead to back problems. You're not supporting the abdominal contents as well. So all the things that we mentioned earlier in terms of bladder and bowel problems could be affected by the diastasis recti as well.
Very interesting, very interesting. So again, for those of you who are joining us late, we have Miss Diane Dallap, who is a physical therapist for the pelvic floor. So she is with Medstar, the National Rehabilitation Hospital. And yeah, there is therapy for the pelvic floor. And they do provide support for incontinence, which is just leaking urine or feces, pee or poop. Also pain with sex. We know that, at least outside of IVF, you have to have sex in order to get pregnant, in order to achieve pregnancy. And so Diane's specialty is helping families in that way. And this is very important information. I know a lot of people struggle with this and they're embarrassed to talk about it, but that's why we have her on to share that support is available. So Diane, if someone is concerned that they may need pelvic floor therapy, what are some questions they can bring to their doctor, or what are some things they can say to their doctor to get appropriately evaluated and then referred on for therapy?
Well, I think if you, whether it's for your annual GYN visit or maybe even your primary care, or perhaps that's one and the same, but I think if you mention the fact that you are leaking or that you notice this gap in your abdominal muscles or that you're having pain with sex, like none of that is normal. I think sometimes women just live with these things, but it shouldn't have to. And so I hopefully broaching that subject, and I would say if they don't suggest physical therapy, maybe you could inquire Yeah, I think just kind of describing your symptoms and any pain that you're having, anything that seems abnormal to you. And obviously your body goes through a huge change during pregnancy, but they are things that should improve the further that you are from delivery. So, you know, within a few months, if you're having pain in the lower abdominal area or in the pelvic area, like vaginal lower pelvic area, I guess I should say, and leaking's persisting, those are things that I think are worth mentioning.
Absolutely, absolutely. And in the same way that if you had an ongoing limp, or if your knee just hurt every time you tried to go up the steps, you would talk to your doctor. Well, don't be ashamed or afraid to talk with your doctor about pelvic pain either. Pelvic pain, incontinence, just feeling like something's not right there. Don't ignore those symptoms. So, Diane, thank you so much. And how can people reach you if they want to set up an appointment?
My email's probably best, and it's my name, Diane, Diane .Dallap, DALLAP @medstar.net.
Awesome. And for those of you who are joining us today, I want to remind you about two things. On Monday, we do have a conference call scheduled so that you can learn more about the Cade Foundation's Family Building Grant, which would provide up to $10,000 for fertility treatment or adoption for families with infertility.